let's get to it. So again, welcome everybody. This is the Art of Mindful Medicine, episode number 24. My name is Dr. Seth Gilson. I'm biological dentist, certified yoga teacher, speaker, and personal coach. And my guest today is Meg Kilcup. And Meg, thank you so much for coming on. Really appreciate you. And everybody, Meg is a holistic, focused pharmacist with a passion for empowering people to heal by creating health through lifestyle changes when possible. She is a doctor of pharmacy
Yeah.
and I'm sorry?
Oh, yeah. Sorry.
Okay, it's okay. She's a doctor of pharmacy and integrative health practitioner and lives in the Pacific Northwest with her family where she loves to get outside whenever she can. So, Meg, happy to have you on. Really appreciate you coming on here. I know we've been trying to work this out for a little while with our schedules and all your travels and stuff, which is awesome, by the way. I've been enjoying watching all the pictures and videos and things that you posted about where you and your family have been going. So,
Yeah.
I always like to start with gratitude. So if you could please share with us 3 things that you're grateful for today.
Oh my gosh. Today I am grateful for, well, I just got to spend time with my parents, a lot of time with my parents, and I don't take that for granted. They will be 70 this year.
That's great.
So I'm thankful for that and that they want to be together. I'm thankful for time in the mountains. It was gorgeous. We just were in the mountains in the snow for 3 days, and I'm thankful for my 3 little sons and my family.
Beautiful. Absolutely beautiful. Tell us a little bit about you. I want to start with a little bit about you, your childhood. What was it like growing up? Where'd you grow up? Things like that.
Okay, so a lot of people on here know that I'm in the Pacific Northwest, but I actually grew up in Arkansas, and it's a gorgeous state.
Hmm.
It's a little different than the Midwest. A lot of lakes and rolling hills, Ozark Mountains. They're kind of
As you were saying, you're from Arkansas. You grew up in the beautiful outdoors. And please continue.
um, yeah. We don't need to go too much into that. I mean, I had a great childhood.
Hmm.
um, but yeah, ended up going out to college at the University of Washington in Seattle, and that's where I really fell in love with outdoors out here. And that's where I ended up pursuing getting my doctor of pharmacy degree,
Hmm.
and have been out here ever since.
Sweet. Very nice. So when is it that you started changing your own lifestyle for health optimization?
Ooh, my own lifestyle. So I would say, for me, I feel like, like high school, college, 20s, I feel like I felt like I was healthy and I was healthy in a lot of ways.
Hmm.
Um, like in my personal life, definitely aware of like fitness and health and that what we eat matters and what we do matters. I like raced in an Ironman, so we spent a whole year training for that and, had like health on one degree.
Hmm.
But at the same time, throughout all of that, I was learning more and more about like, okay, just because, you're eating certain foods a certain way doesn't necessarily mean it's healthy, right? Like, I think in my 20s, I kind of realized, like, okay, everything that's, like not real food is probably not for the best for me. So, like, for example, when I was training for Ironman, I was also like crushing these, like, I don't even know, like Powerade things. Like, I don't even know what was in that. Like I would have done something different now, right? But it's all part of my journey, right?
Hmm.
Um, so kind of learning more about like what really fuels my body well. And then alongside kind of my own journey, not only as an individual of optimizing my own health and all the little ways, but also as a parent, you really start thinking about like, okay, what are we well, first, when you're pregnant, like, okay, well, if I'm going to eat this way when I'm pregnant, I also want to be really conscious of that with, with my children, right? Like,
Hmm.
um, even beyond organic, like, what are even these ingredients in what we're eating?
Yeah.
Um, and then also as a pharmacist, I was exposed to, the whole realm of healthcare and medicine. And I absolutely see a role of Western medicine. And I always like to make that clear because I think there is value in Western medicine. I think it's great that it's available to us when we need it, right? Like if you need to go to the hospital, if you need a certain drug and this is an acute situation, there's various reasons why I am thankful for Western medicine. But I also saw a side of it where I just think we greatly overuse like pharmaceuticals.
Mm-hmm.
And for me personally, looking back, I'm like, wow, I really like, I feel like I took ibuprofen a lot when like I was
Yeah,
training, and
me too,
maybe
for sure.
like worked on my core, and maybe that's why I had back pain when I was training. But I was just like, went to the doctor. They're like, yeah, take 2 weeks of hardcore ibuprofen, and I didn't even really think twice about it, right? And so it's just, I think through kind of my own personal life of kind of treating things like somewhat of a band-aid and not really getting to the root cause. Like I even have an autoimmune disease called Raynaud's phenomenon, and a lot of
Mm-hmm.
women have it. And the first time I got diagnosed with it, I remember the doctor was just like, "Yeah, it's really common," and I was like, "Well, why?" And like, we
God
didn't
forbid.
really talk about the why. And I think autoimmune disorders and things that are going on, I think it kind of the why is brushed over, and a lot of it is not understood yet by many or by all. And all that to say, like in my first appointment, I remember she was just like, "Well, yeah, you can take like these drugs, and some people take them every day to prevent any symptoms." And I was just like, "What? I'm not taking those drugs." Like I was a pharmacist and I knew what some of them were, and I was just like, "That I'm gonna like pass out. My blood pressure is already so low."
Mm-hmm.
But anyways, it kind of really got me thinking about personally, like just how quick people get diagnosed, and then there's not a why necessarily, or a discussion about lifestyle. Like what could I do to heal from Raynaud's or to improve my symptoms? Or I mean, a lot of people heal from autoimmune issues, and so for me, it was just a personal example of what happens in healthcare all the time. And as a pharmacist, I've seen so much compounding of pharmaceuticals and patients that get on a pharmaceutical. Like, what if I took drugs for that Raynaud, and then those drugs gave me new symptoms that I took more drugs for? And
Mm-hmm.
that happens all the time.
Oh
And
yeah, I see
so
that all the time with my patients.
all the time. And then all of a sudden they're on 5 drugs for the first drug that somebody got for something that they could have maybe managed with lifestyle, or oftentimes. And so, I think for me, it was kind of like this culmination of like personally experiencing a lot, learning a lot, and then professionally seeing so much about how we are just diagnosing and treating with a drug rather than going back and saying, okay, well, what's the why? Like, why do we have high blood pressure? Why, like, let's talk about maybe why we have pre-diabetes, or we have diabetes today, or like all the whys, and taking step backs and just getting to the root cause. And over time, I got so passionate about like, okay, let's optimize our health with food and lifestyle first, and
Mm-hmm.
reserve the pharmaceuticals for when we need them. Because yeah, sometimes we'll need them, and that's okay, and there's no judgment. Um, but let's save them for that, right? And
Yeah,
I
I
just think
totally agree.
there's so much power in like what we can actually do
I agree.
to
I think
heal.
we're a lot more powerful and we have a lot more control over our health than we give ourselves credit for, and what other people give us credit for. And there was actually a
Right.
really good question that somebody just asked, and I'm curious to hear your answer as well. Because I mean, now that you're also doing integrative, you're an integrative health practitioner, so you're working with people on their lifestyle and the changes that they should make, they do make, they could make, but they're not making. So basically, the question was, what do you find that is at least one of the main things that prevents people from changing or making the proper lifestyle changes?
Hmm. I think that probably, my guess would be it varies person to
Of course,
person.
yeah.
So like I think the one of the biggest things is just the culture around health in America.
Mm-hmm.
And just like we live in a quick fix society. So it's like someone's like, well, you can take this today, and within 2 weeks, your blood pressure is going to be down like, 20 points or whatever. People are like, well, great. Like, why would I change my diet if I can keep eating what I'm eating? Or you can offer me this pill. I'm going to pay a copay of whatever, $10 a month, and not to change anything, right? And so I think for many people, it's so much easier and it's so much faster. We're so used to fast delivery. Even me, it's like if my Amazon order is delayed a day, you're just like, what? I thought it was 1 day shipping, not 2 day shipping, and now you're saying it's 5 days.
Yeah,
So I
definitely
just
first
like
world problems.
it's total first world problem, and I think that's one thing. I think many people often associate like health or lifestyle changes with costing a lot. And I think that's actually a false perception.
Oh, 100%.
I think that you can eat healthy, you can change the way you eat. If you cut out all the junk and just focused on buying real food, I bet it actually would cost you less. Like when we're
Oh,
not
it
eating
definitely does.
out, when we're not shopping the middle of the grocery store, and buying all those bags of things that cost $5, $10, when you're just buying the real stuff, even if it's organic, I guarantee you're going to save money. But it's that perception of like, oh, it's like supplements and expensive. Really, I think health and wellness can be so simple. And I think that can be a barrier. People think, oh, like it's going to cost so much, whereas this is just so easy. I think that's another barrier, and I think that it's not true. I think it's a total myth.
Yeah,
That,
I think people don't should better understand that nutrition plays a very significant role in overall health and in preventing
huge.
chronic diseases. Because like what you were saying about Eastern versus Western medicine, things like that, I 100% agree, and I say that to everybody. I think they need to
Yes.
be used together. I mean, that using the best of both worlds, how could that not be better? So
Oh,
I definitely agree with you.
yeah, I mean, and I think nutrition, I mean, it's so foundational to our health and our wellness. And I think that as a society, we're so far from really like living and eating how we're designed. Even in my own family, I'm like, we're not perfect. I'm like, what is even in these bars we just bought? Like, they say organic and you read the
Yeah.
label and everyone knows it doesn't mean it's healthy, right? But we're so far from kind of like eating how we're designed, and we're really paying the price. Like, inflammatory oils, there's sugar in so much, and like, I don't know. I just think that if we could, that the issue is that so many like physicians are, so many physicians are amazing, but they're in these appointments with people for 15 minutes, and
Yeah.
there's not enough time
Not
for
even
a
close.
doctor to run through like how to actually make these lifestyle changes and actually be successful and actually equip yourself with like creating vitality. And rather than taking like cold and Sudafed and sinus and stuff all winter long for your colds, you can actually just switch to real foods, boost your immune system. Like it's just such an alternative way of living. And I think, but the reality for the thing for me is like it's actually not alternative. It's just like the original way,
Yeah,
but
right.
now it's called alternative.
And that's the culture, right? That's the
Totally.
culture. I mean, that we've been kind of indoctrinated into. And I mean, I don't know if I have the ability to go back and try and figure out how those things started to change. I don't know if anybody does, because I think there's so many variables that come into play that led to these kind of changes. But
Yes.
I think fundamentally anybody, and I understand how some people think that living a more the type of lifestyle that we're talking about can be more expensive. Yes, there are some circumstances in which, like if you're going to go see a functional medicine practitioner or an integrative health doctor, and they have more of this kind of concierge type service, and they don't have they don't accept insurances or anything like that. Yes, of course. There's you're going to pay like $500 for a consult or something like that with a lot of people, and yeah, that's expensive. Don't get me wrong. And then you're going to get on some kind of protocol or plan for X amount of months that can be expensive. But that's the small thing. So
Yes.
you do that, and that should be like a one-time thing, and then that
Mhm.
gives you all of the tools in your toolbox, and then it's your responsibility because your health is ultimately your responsibility. And I think that's where the cultural shift is. People don't want to take accountability for what's going on with their body, and it's just easier to say, "Oh, I'll take a pill and, like you said, reduce your blood pressure by 20 points," and then you go on your day doing whatever you're doing, and then people don't
Right.
realize that at least a few years down the road, if not sooner, you're going to start feeling or having some sort of effects, and you're not necessarily going to know where it's coming from.
Right. Absolutely. And I think that, like you're saying, it can be more of an investment up front.
Yeah.
Um, but you pay this smaller, you pay an amount of money to get the tools and to understand what's going on in your body so that you can actually access and create healing like the rest of your life versus kind of accumulating chronic conditions, sickness over a lifetime, which then can lead to something even as awful as cancer or an awful chronic condition, which then not only just costs a whole lot of money,
Yeah.
but it can cost you your life. And
Yeah.
so for me, like we do actually budget and set aside like, okay, this year last year my husband did this blood test to figure out some stuff. And this year now I'm going to do it. And we're intentionally sacrificing some things
Yeah.
to be able to put our time and our energy into that so that we can get to know as much as we want to know about our bodies to fully heal. And I think you kind of either pay now or you pay later, right? So
100%.
I think that everyone knows that as we get older, you kind of realize, even me now, I'm 37, I'm like, well, I'm really like not invincible. When you're in your 20s, you're just like, I can do whatever I want. Even like, in my 30s, I'm still feeling good. But, even skiing yesterday, I'm like, wow, I really have to like stay on top of my health. I need to work on my strength. I need to keep on eating well so I can have this energy for my kids and for my family.
Yeah.
And so I think investing, yes, like eating real food is simple, and like working out, that's a simple concept. But kind of what we're talking about is going that next layer deeper, because a lot of people do have even chronic conditions today, right? Whether it's autoimmunity or all sorts of things. A lot of people in America have leaky gut because of what we eat and what we do, and leaky gut can lead to so many things, behavioral, mental, physical, autoimmune, allergies, like the list can be so exhaustive. And so when people want to get to that next layer of healing beyond just like, okay, I need to clean up my diet, I need to get moving, that's what we're kind of talking about, is accessing, getting to the why, and working with someone in that regard.
Yeah. No, I totally agree. And again, just to sum up to this point, is I understand not everybody can even necessarily come up with these kind of upfront costs initially, but every single person on the planet, if you're a human being, you can benefit from eating real food and walking.
Yes.
Longevity studies have shown that just walking is
Totally.
probably the best exercise you can do. If you go walk for 45 minutes or an hour, I mean, and try not to be on your phone if you can, but
Totally.
just like enjoy nature a little bit.
Yes,
Go ahead.
you're so right. We have a little lady that lives next to us, and she's got to be in her 80s, and she's out there walking every day. And I'm like, that is the secret to life.
Yeah.
She's just rain or shine. She's out there and she's doing it. And I think you're so right. Like, there's things that we can do to get to the next level. But the reality is, even just getting in sunshine and being in nature, being in community is free. And that's so powerful. I think a lot of us are actually feeling the burden of just the day of age that we're living in, feeling lonely. Our lives have changed so much. And I think that greatly impacts health. And that has exacerbated a lot of people's chronic conditions, add a whole layer to mental health. And so I think, community, movement, fresh air, grounding food, like all of that, anybody can access anytime. And I love that.
100%, 100%. And you just mentioned something about mindset, and the next thing I want to shift into is mindfulness. And I think that's another really important factor that obviously I like to focus on, and I always like to talk about on the show. So, and everybody always gives their way of expressing this, but what does mindfulness mean to you in your own words?
Mindfulness, I guess to me, it's, am I living, like, when I think about who I am and my why and who I'm created to be by God, am I actually living that out every day, right? Like, am I being mindful of what I'm saying, what I'm doing, how I'm treating other people, what I'm eating? I think it's kind of like, for me, it's the whole picture. And versus kind of just like living in autopilot. And I think all of us can kind of, we know when we're doing one or the other. I know when I'm just like, you're tired or you don't have your energy and you're just like, you're kind of on autopilot. I've got 3 little boys, like there's so many layers. We're renovating a house. It can be easy to like step into autopilot, versus when I'm being mindful, I know that I'm like being intentional with my days and my actions. And even beyond my actions, it's also my mind and like my, like being mindful, even being on social media. Like, are you being mindful with how you're scrolling, thinking about other people? For me, it's kind of like a whole body thing, mindfulness. That's part of the reason why I named my account like Whole Health, because I think when we think about health, like we just compartmentalize it to like infectious diseases or, like your diet, or are you exercising 40 minutes away? And I think that health and wellness is just, it's so much more than that.
Yeah.
And I'm not there, and I will never be there. Like, I think we're all on the journey of intentionally living out kind of who we want to be, and that's totally me too. And something I actually noticed recently is like, I'm like, wow, it is already the end of January. Like, what did I write down in the beginning of January? Like, what are my goals for this year? What's my vision? And something that's really like hit me is like, if you do not develop like a system to execute how you want to be mindful with your mornings, with your business, with your health, then it's really hard to be successful.
Yeah.
Right? So you can like have all these goals and you can say, I'm going to be, a positive parent, or I'm going to like do this and that. But I'm really working on like kind of helping myself be successful in it just through like systems, because it helps me be more mindful when I can actually like do it. You know what I mean? When I actually have the time and the space to go for that run. When I've worked with my husband, so it's like, okay, you're doing this day and I'm doing this that day. Like, mindfulness, it takes more for me and our family. It takes more than just kind of like a fluffy idea. Like,
Mm-hmm.
we have to really develop systems to execute, to be successful. So,
It's about being intentional.
totally.
Yeah.
And I think the other thing that I've learned and I've really been thinking about is, it's easy to get discouraged. Just, like if you're having a day or a week, or like where you're kind of like in autopilot, or maybe you're really improving in something. Um, and then you kind of take a step back. And for me, I'm just learning there's so much grace in mindfulness. There's so much grace in the growth process, right? And in being aware, and it can kind of teach you something. So, like, this is a really small example, but for example, I'm trying to oil pull in the morning, and when I don't do it, I'm not like, oh, you're the worst, like, just like, okay, like, you missed a day, and like, do it tomorrow. And it doesn't negate the fact that I did it the 2 days before. Or
Mm-hmm.
like, I think it like, mindset is so important, because I think in the moments when we don't do something and you get frustrated or you get down on yourself, that stress is
Yeah.
even worse than what you didn't do or you did do. Like,
A
maybe you
hundred
didn't
percent.
want to, pull into McDonald's and you did. And
Mm.
it's like, okay, what did I learn from that? Like, what were my triggers? And, like, okay, 2 steps forward, 1 step back. What can I change about tomorrow? And I think, you could apply that to so many areas of life, even parenting. Sometimes I'm like, ugh, like, that was not the best way to handle that. And that's okay. Like, I
Yeah.
think
Yeah.
that's space for a good conversation with the kids. And, there's grace and there's growth. And I think for me, that's part of like, mindset. Because I think our emotions are just such a big piece of it.
Yeah, no, I totally agree with you. And for example, like the oil pulling, I like that example because I do it as well. I don't do it every day. But what I was going to say is, I don't even think we're supposed to do anything every single day. I mean, obviously eat and breathe oxygen, things like that. But
Totally.
I'm saying like any kind of supplementations, like whether it's probiotics or oil pulling or some kind of
Right.
to- uh,
Totally.
detox drink that you take, like doing things every single day is probably not a good idea because then your body in one way or another becomes a little bit reliant on it. And then the other thing that
Totally.
you said that I really, really like, and I actually thought about this morning when I was exercising, because I knew I got a little bit of a later start and I knew I had to be back by a certain time, is the intention that we set when we're doing the activity that we're doing.
Mm.
If you're going to go exercise, if you choose to exercise, be there and be in the moment and enjoy it rather than
Yes.
just I got to get through this. And then thinking about all the other 50 things that you're going to do. A, that's how you get hurt. B,
You
you're
don't
not
even
going to.
want it again,
Yeah, exactly.
right?
And then it doesn't. That's the next thing. You're not happy about doing it. So then when it comes time to doing it again, you're not going to want to do it. So it's really
Totally.
important to pay attention to these things and mindset. And these are all examples of being mindful. And I really appreciate you pointing that out. So.
Yeah, I love that. That's so true. I agree with your point on the supplements as well. Sometimes, I take various supplements for gut health, or, vitamin D, whatever. And sometimes I'm like, oh, I didn't take them today. And I'm like, that's okay.
Yeah.
Like, I did my smoothie. I feel great. And I think you're right. Like, I think that for me, I do better with the word rhythm than I do routine. They're like, routine is just like morning routine. It just feels so like, I don't know, like I'm obviously gonna fail. I got all these children and like, you know, but rhythm is like, okay, my rhythm, like, like, and there's a little bit more grace. And for me, it feels more natural.
Yeah.
And anyways, yeah, I love that.
Yeah, no, totally, totally. So I know you've worked in the hospital setting a bit too, that we talked about previously. What's been your experience with, and do you feel mindfulness is being practiced in medicine?
Hmm. Yeah, so I would say I could talk all day about this. Um,
Well, okay,
so
we can keep it to a couple minutes.
yeah, no. Well, so the last 5 years of my career, I was a director of safety and quality, and I supported hospitals in reducing use of antibiotics, reducing use of opioids, just reducing adverse drug events, and in that, I worked with a lot of providers, physicians, infectious disease doctors, nurses, CM, like chief medical officers, like so many people in the hospital system and the clinics. And I think the problem, like, I think in healthcare, it's so, it's like a giant, like lots of spider webs all interwoven that are very complicated. And there's so much around the bottom line at the end of
Hmm.
the day. Like, how do we keep our hospital doors open and what's making us the most money? And through that, through the complication of the whole system that doesn't talk to itself well, and everybody in healthcare knows this, um, the mindfulness can get lost. And I think that, in healthcare, you hear the word patient centered care a lot. Like, what's patient? Like, we're going to focus on the patient. The patient is the center of care. But then at the end of the day, we're talking about like the number of patients you have to see in a day, the targets you have to hit, the quality incentives that they have to hit
Hmm.
to get reimbursed by the government for this quality measure. And, like there's so much at play that I think that the patient can get lost in that.
Very
And
often, I feel it does.
therefore, the mindfulness does, it gets lost there. And beyond that, like, we've all been to the doctor. You don't have much time to get to the bottom of things the way that the system has been set up.
Yeah.
And so I think rather than in healthcare, I think there's so much about diagnosis, first line treatment, second line treatment, specialists, like boom, 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 rather like kind of like the future facing, like what are we going to do about this diagnosis we have versus like getting to the why, like the rewinding, like what brought you here today. And to me, that's the mindfulness that every patient needs
Yeah.
is, okay, how do we, like, what's going on? How do we actually create health? Like, how do we actually get you off of the drugs that you're on? Like, that's what every patient should. I'm not saying drugs are bad. If you're on drugs, that's fine. But like, it'd be awesome if you had a provider that's like, okay, hey, let's talk about this. Like, what's
Hmm.
going on with your thyroid? Like, why are we needing a supplement? It's okay that you're on them, but like, let's get to the why. And I think that's where the mindfulness can get lost because there's barely any time,
Hmm.
and it's such a complex web of insurance and providers and financial bias. And
That's exactly where it is, and this is something we talked about. I think that when you mix corporations with medicine
yeah,
and
yes,
healthcare, it just doesn't. One of them is going to give, and as we all know, which one gives, it's either.
yes,
So,
the financial bias is very strong, unfortunately, in pharmaceuticals. Now I'm probably going to start getting censored if I start talking about this. But I just think there's so much money there, and there's no, there's not the old school like where they can take out doctors and give them like like there has been changes to practice to improve, but it's still such a strong component of how we all think in healthcare, and it's just like the forefront of it, right? And I think that can take a lot of the mindfulness out of it to the
yeah.
point where anything that isn't pharmaceutically driven all of a sudden becomes alternative or dangerous, and more holistic. You're just like, and I mean, even in pharmacy school, I remember being taught like that supplements are dangerous because they're not monitored by the FDA. And so therefore, because there's not large clinical trials, we really don't know as much as we know about like Advil or any other pharmaceutical, right? And so in my mind, all supplements were dangerous, and patients, like, it was really just like this total mindset that I was handed. And I went to a great pharmacy school, but that was the vibe around it.
So
And now
that way
I'm
of
like, okay,
thinking, sorry, I
what?
don't want, but that way of thinking, doesn't that completely dismiss the fact that all of these drugs are formulated from herbs and natural plant compounds in one
Right.
way or another? I mean,
Yeah.
so whatever they discover, I mean, it's not just like they created something. It was already there. They just formulated it for them to manufacture and then make money off of. So
Yeah. I mean, and I think it's just, it all comes down to the money. And I think that something else that I realized, even beyond your point, I completely agree. And, I had something on the tip of my tongue. Um,
sorry, I know I cut you off.
no, it's okay. It was about supplements. Oh, the FDA. So just because the FDA approves something as being safe and effective doesn't mean it's necessarily safe and effective. And once I
Yeah.
learned that, okay, just because the FDA has approved X drug for X condition, 10 years down the road, we could find out that drug ended up causing cancer or causing all these sort of things that wreak havoc on the body.
And that
So, like,
happens a lot.
all the time. And I think that, once we realize that, like, evidence-based medicine, yes, we need it, but it's literally always, it should be always changing, because that is science. And therefore, it's not like a hard truth all the time.
Mm-hmm.
And just because the FDA says something, I was like, wow, okay, so the FDA said that was safe, but now we know it's not. So just because they didn't say the supplement is safe doesn't mean it's not safe. Like this turmeric supplement that I'm taking, like,
Yeah.
it's from a plant from the earth that is a totally awesome superfood, and we're using it to support our bodies sometimes.
That's
But
been used for thousands of years, and the FDA hasn't been around for thousands of years. So it's not like the FDA is like the godsend that figures out all of these things that nobody else in the world has ever been able to figure out, because that's just not true. I mean, it's actually pretty easy to find research that's done, I mean, from a long, long time ago, and how herbal medicine has been used for centuries.
Right.
So,
well, and to add on to that, so I know this is TMI, but I got a guy in December, and I was like, okay, I am going to try to treat this naturally, and I had never done that before, and it was honestly kind of scary. And at first, I was like, wow, this is a lot. But I got all these messages from people that were like, my great grandma used to boil corn husks and then drink the water, and within hours it would be gone. Wow. Or my like the, Indians used to do parsley tea and like all these things. And then you go and you read studies, and it's like, there's reasons why it worked, and it actually worked. And what I did actually worked. And it was from generations of humans that would get these infections over time.
Yeah, these aren't new infections.
And they would mash up garlic and eat it, or they would do all these things. They would use the plants from the earth to heal. And that wisdom, those ancient remedies have been passed on. And sometimes they might, like, if it didn't work for me, yeah, I'm so thankful that antibiotics are available if we need them, right? It happened to work for me. It was really cool to experience. Like, wow, you can actually just like take these things and eat these things and heal yourself without needing antibiotics every time. Like, awesome that it's there, but I just think you're right. Like, it's not, people were figuring this out before pharma.
Here. Like, wait, I mean, the only reason why that became an industry or anything is because of all of that knowledge. Like, they saw that these things worked, and that the only way they could patent a drug or whatever was to somehow reformulate it from its natural form. I mean, whatever. Yeah. Anyway, so I want to get on to some more information about this, because, like you said, we could talk about this for days, and I know we can. So, one of the things that you alluded to, which is what I wanted to talk to you about a little bit, was this idea of like one size fits all medicine, and what the role of the pharmacist really is, and like what it traditionally has been, and kind of how it's changed over time. Because I know in other countries still that the pharmacist, like the someone will go to the pharmacist with illness A, and then the pharmacist will say, they'll take into consideration their age, their gender, their weight, their diet, like if they've had other illnesses in the past, and then they'll formulate something for that ailment.
Mm.
And because nowadays it's like, okay, like you said, like for example, aspirin, 81 milligrams of aspirin is like a traditional thing that people, I guess, in their 60s and up take for a variety of reasons. But
Hmm.
that 81 milligrams of aspirin doesn't necessarily work the same for everybody. So it's like,
Right.
what's your feelings about how that, like I said, the one size fits all method, and like how has things changed from what traditionally pharmacy was supposed to be to how it is now?
Sure. And I can speak from just, like as a pharmacist and just my perspective on the entire healthcare system. I've been a pharmacist. I've never actually worked in a pharmacy. I was super interested in public health, and from the very beginning, I was almost disgusted at the amount of just drugs. So I got into patient safety, and I've always been more like on the administrative level, I guess you could say. I'm no longer working in that regard, but I will say that after being in healthcare for 10 years, after being a pharmacist and seeing everything from down to the patient at the pharmacy to the top of the system, um, one size fits all medicine makes absolutely no sense. And I think that is the complete opposite of patient centered care. Um, we are all so there's so much bio individuality. We all have such, like, from the moment we come out of our moms, like, we all have a different path. And I think that it gets really, I think that's where a lot of the issues come up. Like, even, like, let's take, because when you think about one size fits all medicine, in that case, you are basically saying the evidence as it stands today is true for you and true for everybody. And it
Mm-hmm.
should be applied to all in the same fashion. And if you look at the history of medicine, the evidence, you look at 100 years ago, you're like, oh my gosh, what a joke.
Mm-hmm.
100 years ago, 500 years ago, 20 years ago, even the opioid crisis, right? Like, if
Yeah.
you're to follow that evidence, one size fits all, can you imagine? We already have an entire opioid crisis based on the fallacy of all of that. And that
Mm-hmm.
is just one example. And so I think for me, when I think about one size fits all medicine, you're basically saying that the evidence at the point in time today should be applied to you, because that is what the medical community is saying is true. But unfortunately, there's so much bias that is
Mm-hmm.
interwoven into the evidence. There's even publication bias. So you can
Yeah.
have some publication that's
Huge.
going to go out against whatever the current recommendation is, and it just won't get published. And people are like, well, there's no literature on that. Well, it probably didn't get published because it probably doesn't agree with whatever pharma is saying.
Yeah.
And so I think for me, I'm so much against that one size fits all medicine, even beyond bio individuality and genes. Genes have a huge play, like our environmental exposures, our life. Beyond the individual, it's also putting complete trust in the system, which has shown us time and time again it's not it's not always true and reliable. And I'm thankful that it's there for us. I'm thankful that I can go to the hospital if I need to go to the hospital or whatever. Like, I think we can all agree on that. But the system in itself has never proven to be like, okay, the patient is the center of the care of care at the end of the day. And
Yeah.
so that concept and the concept of mandating whatever, like, medicine is saying is the gold standard of the day, to me, goes completely against someone's free will to decide what is going to go inside their body,
Yeah.
based
You
on their
actually just
biology and all that.
so you actually just touched on the two of the next things I wanted to ask you about. So, you were talking about being more of playing an administrative role and being there to support doctors and work with the doctors
Yeah.
about pharmaceutical drugs. So, in your opinion, obviously in your experience, how much depth of knowledge do the doctors clinically have on the ingredients and the side effects of these pharmaceutical drugs? Like, where do they get their knowledge from? Are they reliant on the reps or the pharmacists that come to talk to them about these things, or like how much exposure are they getting themselves and with the research that they're looking at?
I really try not to speak for doctors, because I just like, um, but I can speak to my experience with many of
Yeah,
them.
yeah,
So I'll do
exactly.
that.
Yeah,
Because I think there's just like pharmacists, naturopaths, dentists. You're going to have some amazing doctors that know a lot. You have some that might literally just memorize some stuff in med school, and now It's like, diagnosis, boom, like here's your script, treatment, out the door, right? So I think you're going to see the whole game of it. In my experience, um, I'll take antibiotics, for example. A lot of doctors, they just, in the hospital, they would know, like, okay, patient has this infection. These are the drugs we're going to give them based on the first line, second line treatment, or based on the resistance. But when they needed that extra, when they really need to know something, they would reach out to a pharmacist um, to get to the details. But what's interesting is I'm a pharmacist, and I was really trained. I would imagine the doctors, it was kind of more like you understand the basics of like, okay, why does an ACE inhibitor help with, blood pressure? Or why does, how does an antibiotic help with treating an infection? So I would learn those mechanisms, and I'm sure the doctors had to learn that through med school. So it's,
Yeah, no, we
blocking this
definitely did.
pump, right? Changing this mechanism, but you learn it's like this tiny little, section that you learn. Like, okay, this antibiotic treats for this, but I didn't learn like, oh, but these are all the other things that antibiotic can really do to a person. You kind of learn some side effects. So fluoroquinolones, people can like rupture a tendon, but you really didn't talk about like this can actually wreck a kid's like microbiome for their childhood and maybe their life if they're given too much of this for ear infections. Like, so I would imagine doctors, just like pharmacists, did learn like, this drug for this disease or this drug for this infection, and you kind of just like learn it and you lock it away. But it was just so, for me, memorization based. And I know like a lot of doctors I've heard, I had friends in med school, they like hated the pharmaceutical part of it because it's just like so much, it's so intense. To like basically memorize all that, right? But there's not a lot, from my perspective, put into the component of like, what else is this doing to the body? Like antidepressants or hormones. So you can give a hormone, you can take an antidepressant, you can take an antibiotic, and sometimes those might be needed. But if they aren't, what are all the other things that they're doing to a person's body in the short term and in the long term that could be prevented by not using a pharmaceutical? So, I know that doctors learn some, but it's, they definitely, I'm sure so much more of their education is more on like the diagnosis component.
100%.
So
I took pharmacy with the med students when I was in school. I mean, the
right.
dental students and the medical students we took the same exact classes, which most people probably don't know, but whatever, it doesn't matter. And yeah, and I don't even remember hearing the word microbiome until I was long out of school. Like that's not even like.
Or gut health or leaky gut. Like I remember, like antibiotics. All I remember learning is just like, yeah, like these are the ones. This is what you get for UTI.
For this,
is what
yes.
You get for pneumonia. This is what And
I mean,
not once really to talk about the whole picture of someone's health. And I think that some providers are very wise and they're thinking about that, or some teachers, but it wasn't until I was like, wow, we're really just spotlighting. Even take IBS. Like, this is what patients should take for IBS. And it's like, okay, well, there's 100 reasons why a patient could have IBS and have issues. And you're giving them this one drug that is just going to like maybe help with their symptoms, but it's not at all getting to the root cause of what is going on. And, those 100 patients might need 100 different things for their, GI stuff that could be caused by all sorts of things. And so I think that it's just like this little piece of the pie that's kind of covered, So yeah, that's kind of my perspective. But my other thought too is providers, oftentimes they want to do the right things, but they don't because they don't have time, or the patient, they want to do what the patient wants because they get reimbursed sometimes based on the patient satisfaction. And so if a patient comes in and is like, well, I want antibiotics, I have a cold, and my back hurts, I want an opioid. And providers, they'll tell you, they're like, well, we got to get the ED cleared out, so we're just going to get these people moving, right? So it's like, it's just so much more than like meets the eye.
It's kind of disheartening because, I mean, it's very much so like that in dentistry. But I want to be respectful of your time, so I don't want to get too much into that right now. I do have 3 more questions for you. So, and this is something you just touched on a couple minutes ago, and I wanted to know your feelings on mandatory drug protocols, because I know that's something you've worked on.
What do you mean that I've worked on? Well, that I'm
Well,
passionate.
like with drug protocols and things like that.
Yeah. So I'm just against really mandatory anything when it
Yeah.
comes to healthcare. Kind of on my experience in kind of seeing the micro and the macro. When you have the 30,000 foot view um, of what's going on, and when you assess history and looked at history, I just really strongly disagree with mandating anything because you're really putting complete trust in government systems and big pharma.
Hmm.
And because ultimately providers are operating within that realm. So providers have to keep their job. They want to keep their job. They're not going to step out of line to go against the mandate of the recommendation because they have kids and mortgages and bills, and
Yeah.
so they're operating within the confines of whatever the government is saying and whatever basically pharma is saying as well. And so so therefore, if when I look back at history, I'm like, okay, are governments always ethical, and is pharma? For me, that answer is pretty easy to answer. So whether you're talking America or any other government in history, and I think that unfortunately financial bias is so strong that I don't think that patient-centered care is driving mandates. And so there's so much at play here that I could talk about, but I think there's this huge system at play that's driving mandates. To me, isn't necessarily thinking about whole health,
Hmm.
and then so you have this system and pharma and government, and we have what history shows us. Um, like giant lawsuits of pharma lying, right? Like corruption, fraud, like, and not even that long ago.
Not
Um,
long. No, not long ago at all.
and it's like those they haven't changed overnight, right? Like I say, I'm thankful that there's drugs available, but I don't want it to be forced on me or my family. But then you also have bio individuality. So what we know is that sometimes if you're going to mandate a drug, especially an experimental one, people respond differently to different drugs, and that is
Hmm.
crystal clear. So you could give the entire population a peanut butter and jelly sandwich, and some people are going to have an anaphylactic reaction and some people aren't.
Yeah.
And so the same thing is going to happen with pharmaceuticals, with with all sorts of ingredients. And the reality is we don't know people's genes. We don't know how they're going to react, whether they're 6 months old, 90 years old. We don't understand the impact of these products on autoimmunity. So there's so many layers. And I think something that got me kind of like the gumption to speak up on this platform is I am all for people saying, okay, yes, I want whatever drug the government is saying I need to take, or my doctor. If they want to be able to choose that, I'm like, yes, that is great for you. But if
Hmm.
someone does not, to be literally forced to take something that pharma and the government says you need to take, to me is criminal
Hmm.
because you're losing the right to what is going in your body and the chance to say, you know what, I'm just going to sit back and maybe watch this happen for a couple of years and see what's going on here. And I'm going to think about all my chronic conditions and all, like what if you already have autoimmunity and you don't want that product? There's even discussion of removing medical exemptions to a mandated product, which to me doesn't make any sense at all because you're literally saying, yes, we know you're at risk of having a worse reaction, but still you have to do this because it's required by law. Like
Yeah.
you're mixing law and
Yeah.
government and financial bias with someone's health, and I just think it's too much based on what I've experienced and what I've heard firsthand as a healthcare provider.
Yeah. I'm with you. I mean, I can't imagine how something like that could ever actually happen or be allowed. Um, but I definitely agree with you. I think it takes complete autonomy away from the individual, and like you said, I think that's something that is essentially a criminal act, and because you cannot. Sorry, I don't know. My phone cut off. You cannot dictate um, how somebody's health is dealt with by other than themselves making those decisions. So
Yeah.
um, Okay, so you answered both of those two of those three questions. So thank you for that. So final question today, and again, I really appreciate you guys coming on. Thank you everybody for tuning in and watching this. It's fantastic of you guys to take time out of your day to come and watch this with us. And my last question is this: if this were your last time you ever had to share your thoughts, and you could only share three things that people should start implementing in their lives immediately to improve their health, what would they be?
Oh my gosh. um, Immediately to improve your health. I would just say, for me, one of the most important things for health is mental, spiritual, emotional. So it sounds cliche, but knowing who you are and knowing that you are like made purposefully and you are loved and known, I think that is huge on your journey to health. So yeah, for me, all the right things. But if I didn't know who I was, that I'm created by God and I'm known and loved, I wouldn't feel satisfied. So that's what ultimately fills my heart, fills my days. Um, and outside of that, two other things, super simple. I'd say get outside, move your body outside, and eat more real food. That's what I'm working on. It's back to
Awesome.
the basics.
Awesome. Totally
Yeah.
agree. Totally agree. All right, everybody. Thank you guys so much for watching. Meg, thank you for coming on here. Everybody, please check out Meg's Instagram at A Whole Health Life. Are there any other outlets people can reach out to you on, like websites or anything like that?
I do have a website. You can find it in my link in bio, but yeah, that's me.
Gotcha. Awesome. All right.
wholehealthlife.com. Yeah.
Sweet.
Yeah. Thank you so much for having me
Yes.
on.
Absolutely. And everybody, I always welcome your comments, feedback, suggestions. Feel free to check out all the previous episodes on my YouTube channel, The Art of Mindful Medicine. Also, my website, www.mindful.doctor. And of course, we are on Instagram Live, and I'll always announce the new episodes. And of course, I'm going to end with a quote. Today's quote is from Albert Einstein. And he said that life is like riding a bicycle. To keep your balance, you must keep moving. So that's just, it's an important message. Wherever you're at today, just keep going. This is your new starting point. So again, everybody, thank you
Love
so
it.
much for watching. Meg, thank you so much for coming on. Have an awesome rest of
Yeah.
your day.
You too. Okay. Bye, everybody.
Bye, guys.